ನೀ ಈಗಾರ ಕುತ್ಕೊಂಡ್ ಮಾತಾಡಿ ಏನ್ ಮಾತಾಡಿ
Yeah. So we are live. We'll just wait for 2 more minutes. In fact, 3 more minutes. Just something to talk to Aditi. We have 3 more minutes. We will start this podcast. Yes, speaking of.
Hi, Dr. Anuja.
Hello.
Hello, doctor.
Yes, hello, sir. Am
Yeah.
I audible and very
Yes,
clear? Is
you are.
okay?
You are loud and clear.
Okay, that's great.
How about
Yes.
us? You can hear us fine?
Absolutely. Perfect. No problem.
Okay.
Okay.
So I think
we have
time.
3 more minutes.
So we'll wait.
4.
Is that okay?
We'll just wait for another minute
Yes.
or two. Let people join, and we will
All
begin.
right. Yes. All right.
Yeah.
Thank you very much for this opportunity.
Yes, I think it's our pleasure, doctor, because
Yeah.
we have been like wanting to talk to you to see if we can raise awareness, and what better week than breastfeeding
Yeah,
week, right?
true.
So
Very true. And it's nice that I also get to at least tell whatever I have to, hoping that it reaches more people.
yes,
Yes.
the best part is it'll reach like everyone on the internet, so it's like
Yes.
pretty global that way. So that's the good part of YouTube Live.
It's the
So
first
yeah,
time that I'm doing this.
is it
So,
okay?
That is wonderful,
Okay.
doctor.
Yeah, good that you are debuting with us.
We could be part of this. I mean, it gives a good feeling.
yeah.
Yeah. So we'll begin.
We can. I mean, I think there were a few who asked for the link, so I'm assuming they
They
wanted
will
to
be
join.
joining. Yeah.
So whatever it is, let's begin at 4.
At
We
4.
have about a minute.
A minute.
To go.
Yeah.
We'll officially begin with a welcome note at 4.
Yeah.
Okay.
I'm just checking.
I have also kept some things with me in case
Oh,
I
good.
have to show anything. So is
Yes,
it okay
yes.
if I
Yeah,
stand with
yeah,
the
yeah.
breast model and the baby?
That will be
That
wonderful.
will be very useful. Yes.
Yes, doctor.
Okay. If at all there's anything that I need to explain, it's just for that.
Yes.
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 Okay.
And there will be questions, and also we will take it how it comes. So
Yes.
you will be explaining. We'll have maybe a short break wherein question and answer. Aditi will be having questions, and we will have that Q&A. Yes, doctor.
All right.
Yeah.
There's a slight lag, I think, in your video.
Now?
Maybe when you were
Now is
speaking
it?
just now.
Yeah.
It's okay now.
It's
Yeah.
okay now.
It's okay now. Okay.
Yeah.
Yes.
All right.
If I'm overshooting the time or if I'm answering one query for a very long time, please let me know
Sure.
so that I'll
Sure.
cut short.
Sure.
Yes.
Yeah.
Okay, I think we have about 9 people who have joined.
Yes.
That's good.
Okay.
So,
Thank God.
Sujay,
I
maybe you
was.
can.
Yeah. All right.
Yes.
Yeah.
Hello. We will begin this podcast. So, hello and namaskar to all you lovely people. This is World Breastfeeding Week. Internationally, it is celebrated between 1st August and 7th August. We are right in the middle of World Breastfeeding Week. Today is August 3rd and it is 4 o'clock. We are live on YouTube with a podcast. Aditi is my co-host and my better half. Aditi, we have viewers from North Karnataka, India, and outside India too. So I must say this. Hengidiri Ellaru, how are you all? Speaking of North Karnataka, we have with us Dr. Anuja Joshi, IBCLC. She is International Board Certified Lactation Consultant, and she is the founder of Anandi Lactation Support Center, Hubli, first of its kind in North Karnataka. So, World Breastfeeding Week this year has a theme, and it is closing the gap. Aditi, let's put our hands together in welcoming Dr. Anuja Joshi. Welcome, Doctor. Aditi?
Hello,
Yes.
doctor. So, welcome formally to our podcast. Thank you for
Thank
accepting our
you.
invitation to talk about breastfeeding during this special week. We have some viewers already, and I think if you can maybe talk a little bit about yourself, your profession, and about Anandi also, that would be really great.
All right. Yes. Firstly, thank you very much, Miss Aditi and Mr. Sujay. It's the first time for me on YouTube, and there is no better way to do it. And also with both of you. So that's the best part. Thank you very much. Now, thank you for a nice introduction. I am Dr. Anuja Joshi. I am a periodontist or a gum specialist practicing at Joshi's Dental and Maxillofacial Clinic in Hubli. Along with that, I'm also a lactation consultant. I did a basic lactation certification course about 3 years back because I was interested in it, and it was purely out of interest that I went ahead with it, which is also when I found Anandi Lactation Support in Hubli. It's a support center where we have mothers coming in with various breastfeeding challenges, starting from prenatal to during their phase of breastfeeding, weaning, starting solids, everything. Anandi was the first baby that I saw as a lactation professional. And
Oh,
the first case is always special. You get to learn a lot more from the child than you do from the books. And that baby is very special to me. And that's why the name is Anandi. So that's about my
Fantastic.
clinic. Last year, I also gave the international board exam, the American Board for Lactation, and I'm through with it. So now I have the IBCLC certification, which is the international board certification, and I'm hoping to grow, get to have more experience in this field, and along the way also try and help and support mothers whenever and in whichever way I can. So thank you.
yeah.
Yes.
Thank you, doctor. So, yeah, I think it's a very noble thing that you initiated this because just having someone with so much credibility, also with a noble intent. I think it's really great to be guided by someone like you. We have some we want to make this a little bit interactive, so we thought we'll have some questions by us, some by our subscribers, and someone who wrote to us. So maybe we can start with it
Yes.
already. So
Yes,
I have
yes,
my phone
definitely.
with me, where I'll be checking live questions also, in addition to the ones we have noted down from you guys. So let's start.
Maybe initially we will go ahead with few questions, and Dr. Anuja, you can take through the intricacies of breastfeeding week and what it is all about. So, I mean, how is that? You're good with that?
All right. Yes.
Yes. Yes.
So,
So,
Breastfeeding Week is celebrated globally from August 1st to 7th, like you mentioned. It was started almost in 1991-92, and since then it's been going on. It's of course picked up pace now with more awareness spreading. What is the whole idea of having this week? The whole idea is that basically all the awareness days and weeks are so that we just go on talking about it all the more, and people get to hear things about it, and that
right.
probably makes them curious. Or when
Yes.
they are in a situation where they get to know that, okay, this was something I heard, they could approach the right person and get some guidance on it. So, this is
Right.
primarily the idea, and that's the reason we go and offer education, knowledge, basic information about breastfeeding so that people know that, okay, there is something like this and it's not so easy. It's not as easy as just lifting the child and getting him or her to the breast. It's not so easy. It's a learned skill. So,
Right.
Breastfeeding Week is all about that, celebrated every year globally.
Right.
Now, this year, closing the gap is the theme. What do
Mm-hmm.
they mean by closing the gap? Breastfeeding is not really only the mother's responsibility. And at so many phases, she will feel that she needs adequate support, be it emotional, physical, from her family members, from her healthcare professionals, from her spouse. And they can offer this only if they have some basic idea about what is right and what is wrong, and there also has to be a little change in their attitude towards what their thinking is as of now. And that is how we can try to bring them together. So if there is a mother who chooses to do something which is probably not something that everyone would want to go ahead with, but if
Right.
she has the right knowledge, if she's armed with the right knowledge and she's making her own decisions, knowing what is good and what is bad, or what is not right or ideal, then there's absolutely no problem in it. And then we should be supporting her in every decision like that. And
Right.
that brings down her mental trauma and stress significantly. She's able to do things, whatever she's doing, in a much better way. And sometimes that will also show in her bond with her child and improve breastfeeding in general. So, closing the gap is basically bringing together family members, partners, communities, neighborhood, so that they don't really have queries and they don't question what the mother is doing or why is she doing it, how is she doing it. They are rather just supporting her and helping her in whatever she wants to do.
Right.
Yes, yes, that's very important, doctor. So I think that kind of brings me to this question, because I don't know, it's probably a mentality that we have here, mostly in India, that we reach out for support or reach out for information only when something is not working out right. So at what phase of let's say pregnancy, like it's the earliest stage that we can think about, so at what stage of pregnancy should a expecting mother start preparing, mentally preparing, physically ensuring her body is getting ready, doing the right things, so that her lactation journey is smoother, and probably when can they start to reach out to a lactation consultant also, like what would be the right approach here for an expecting mother?
Yes. So, see, anything that we do in life, when it is something that's quite a turning point or that's going to change things in future significantly, it does need some amount of preparation or homework from our side. Ideally, it's better if we do it. So,
Yes.
having a baby is a very important phase. It's a phase that's going to change your life forever in many ways and for the better. So why not get some basic knowledge and idea about general things that will improve your journey? It doesn't mean that you will not have your bad days. You still will have, but you will still be in a much better position to handle them, having the
Mm.
knowledge and not panicking or stressing over things, because you know if you're doing the right thing, if not now, later things will fall on track. So that's why it's essential that you do your homework. Now, even when you are looking at conceiving, I will also speak from the point of view of a dentist, because dental treatment cannot be done in the first 3 months and the last 3 months.
Oh, okay.
The fourth, fifth, and sixth months are considered safe for any dental treatment. So when you are looking at conceiving, that should also be, in your mind that let's get everything sorted. Or if you
Okay.
have not been able to do that, then in your second trimester, do visit your dentist and make sure that every little thing is handled, because we don't want mothers to come in the third trimester just 2 weeks before their delivery with a swelling where we are not able to do much.
Mm.
So that's why preparing begins not just in terms of that, but in many aspects of the mother. Along with that, also have realistic ideas about breastfeeding. So don't think of it as something that's going to be very smooth. There are not going to be any issues. It's quite easy. Everyone in the family has done it. So it is nothing like that. Everyone has their own challenges, and that's why when you talk about breastfeeding, you should probably a prenatal class is of help to the mother, because they at least expose the mother to what she's going to go through in the first week post delivery. You don't really make sense of day and night, nothing is on track that time, and you are also stressed about feeding the child when you feel that I don't have any milk supply. So it's not a very great situation to be in. So why not have a basic knowledge about it? And the best time according to me to get that done would be somewhere around the 8th month, because
Okay.
I feel doing it in the first or the second trimester is a little too early. By the time you actually reach that stage, you would have forgotten half the things. So if you've crossed your 8th month, and that is when you're looking at getting a prenatal class, that time your attention is on everything that is regarding the baby because you're so close to it. So you will have more queries, you will be thinking accordingly, and your attention will also be better. So that would be the right time to get a prenatal done. Along with that, health per se, you have to be careful about your health throughout, but making sure that once you are pregnant, you are eating well, not going on any diets which are not going to be very sustainable. So have balanced meals, eat well, eat frequently, but also maintain an active lifestyle. So it is this when you do that actually helps in improving your milk supply when you're actually postpartum and only trying to consume foods that someone feels are going to help in your milk supply. It never really happens that way. So you
Mm.
have to have it has to start much earlier and make sure you're getting all of that done. As you get closer to your delivery date, because you have knowledge about things, you will be calmer.
Yeah.
Get into the habit of doing something that you like. So engage some time in your hobbies or anything that makes you happy because that will calm you down. And as you're closer to your due date, again have don't have very heavy meals. Have short meals more frequently. That will be more helpful. Also, foods that will give you more energy for a long time because in labor you need energy for a long time and
Yeah.
not the energy kind of energy that you get through sweets. So accordingly, plan your meals and then go ahead with your, due date and delivery and all of that.
Yes. Yeah, I think that's a good point. So, are there any kinds of food that we should not eat? Because I
Mhm.
think there are certain good diet for expecting mothers, but is there something that we have to keep specifically in mind, keeping lactation and the next journey of breastfeeding? Like, is there something that they should not consume?
Okay, so now coming to foods, ideally, see all these foods that have been coming down traditionally in our families that eat this, it is good for, a lactating mother. Scientifically and research wise, there is no confirmation that yes, this does make a difference in milk supply. But having said that, because it has been believed to improve your milk supply and there have been generations following it, there must be some truth to it. And that is
Mm.
how we go ahead with. So there are certain foods which help in improving your milk supply is what is said. I will tell you a little more about it a little later. In general, foods like jeera, ajwain, methi, badi sauce, oats, drumstick, sabudana, dinka or antinundi, what they call,
Mm-hmm.
methi, sabasgi, garlic. All these are foods that are known to improve a mother's milk supply.
Okay.
However, a lactating mother ideally should not be consuming alcohol for at least the first 2 to 3 months. If at all she wants to do it a little later, there are some guidelines so she can follow that and not feed her child for the next 2 to 3 hours after
Mm.
consuming a glass of alcohol. So she could follow that, she could get in touch with the expert and she will know how to go about it. Along with that, there are certain herbs, say mint or pudina, which sometimes drop your milk supply. So if there's
Okay.
anybody who's routinely eating those in their chutneys or food preparations, they could avoid it. Having
Mm.
said this, there is no significant research about it. And to talk about milk supply, keep in mind that all of these foods, or even shatavari is extremely good to improve one's milk supply. All of these have very limited effect on working on someone's milk supply. They just act as adjuvants to your milk supply. Milk supply primarily is based on demand and supply. So the more you empty your breast effectively, the more it refills. For anything to refill well and faster, it has to be emptied well. And that's the whole principle on which one's milk supply works. But what happens is we concentrate on everything else and not so much on this.
Right.
Right. So, regarding milk supply, so how does one consistently maintain that milk supply? Because I think some mothers are lucky enough to have enough milk supply as soon as the baby is born, but some may not have it due to whatever various reasons. We'll come to that. So, what can a mother do to ensure it's initiated firstly and then maintained also?
Yeah. So, breast milk supply and maintenance, the earlier you initiate or establish breastfeeding, the better it is in the long journey. So, how early? Ideally, the first feed should go into the baby's stomach within the first hour of birth.
Mm.
So that is when the first feed must go in. Now, usually what happens is most of the times in the first 1 or 2 hours, the baby is never with the mother for
Yeah.
medical reasons. And that's why baby is almost always given top feeds or formula feeds, and the mother actually gets to see the baby much later. So she's lost a good 3 to 4 hours of not expressing her colostrum or giving it to her child. So make sure that even after delivery, if it is possible, then do try to feed your child as early as you can without worrying about the volume. Because for the first 3 days, the volume is not going to be great. It is thick called colostrum, which is rich in fats and extremely good for the baby. So that has to be given. And when you keep giving that every 1.5 or 2 hours frequently throughout the first 3 days, it is then that on day 4 or day 5, your milk starts coming in well. But when this initial stimulation is not, it's not happened, and suddenly on day 5 or day 4, when you feel that now my breasts are feeling heavy and I have milk, and you sit to latch, you have to actually learn from holding the baby and getting the baby onto the breast. Okay, so that takes up another few days, and that puts you off track. So that's why it's always better to start early. And when you feel that you are not doing it right, or you are unsure of what is happening, if is it happening correctly or no, then attempt to get the baby on the breast at every feed, and then drain out your breast with your hands. Make
Mm.
sure that this milk is fed to your child through a spoon or a palate, making sure that he gets mother's milk and your supply is maintained, because you're constantly removing milk out. So when
Yeah.
you do that, every mother still has her own capacity. So
Mm.
maybe on day 7, there would be a mother who's making much more than what somebody else is. Here, there is also some medical health that comes into picture. Is it an IVF delivery? Does she have any thyroid issues? Is there any hypertension or diabetes that is involved? So all of these do play a role, and they may delay her milk coming in by a few more days. However, there is no mother who will never be able to feed her child. So the more we feed, the more body goes on making. I may
Mm.
not make 60 ml that somebody else is making, but it will still be enough. It will have the satiety that my child needs. And until then, you will have to cover up the gap with something else. And whatever that something else is, the aim should be that we gradually start weaning off our baby from that, trying to get the baby more on the breast. So milk supply develops and builds very slowly. If I start a shop or open a shop today, I can't expect 50 visitors on day 1. It will take 2 to 3 years for me to actually settle down and be happy with it. So just give your body the time, keep getting the baby just to stimulate your breast, and then the body starts working on its own at their own pace. So don't
Right.
compare.
Yeah, I think that's a very important message because, yeah, when mothers do tend to compare, or maybe they are compared by others.
Easily.
So, yeah.
Yes.
So you mentioned about colostrum, right? So this is just something which, when I was expecting, I used to, try to get as much information from the internet as possible. There, it used to be mentioned that, before the birth, there is something like golden liquid that someone can collect and store. I don't know if it's good to store, but is that something that's worthy of doing or exploring by expecting mothers before delivery?
So see, colostrum or mother's milk basically is called liquid gold.
Hmm.
Now, coming to that, because I haven't mentioned the guidelines, breastfeeding, the first 6 months of exclusive breastfeeding, and then continued breastfeeding for up to 2 years is what is the recommendation by WHO and the American Academy of Pediatrics. So, first 6 months, you should not be giving your child anything apart from your own milk or mother's milk. So imagine if there is a life that can survive for 6 months even without having water, then we don't need to stress how important and how good and useful it's going to be. It has everything that the child needs, and probably that's the reason why it's called liquid gold. in general, mother's milk. Now, colostrum is just the initial part of milk that the mother is able to express. Can you store it? You can start expressing colostrum right after birth also. You may not really have to do it initially or before birth. So
Hmm.
if you know that your baby, you're going to be away from your child for some reason, you could keep on expressing colostrum right after birth. If you are not in a position to do it, the sisters or hospital staff can help you do that, and that can be fed to the child by a sister or somebody else.
Hmm.
Whether you should be doing it before delivery. Now, usually there are studies which mention that when you stimulate the nipple, there is oxytocin released, the hormone, which can contract your uterus and give rise to premature labor. And we
Hmm.
don't want that. So that's why too much of doing that before delivery is not recommended. All that
Hmm.
you can try doing is maybe 2 or 3 days before your due date, because you know that you are almost there, so
Hmm.
you could take a chance that way. So 2 days before your due date is fine, not for very long durations, not more than 3 times in a day, and
Hmm.
maybe 5 to 6 minutes per phase, per session. So if you want, you could do that and try and remove a little bit of colostrum if at all there is anything coming. If
Okay.
not, then you will of course have to do it later. Also, you need to understand that milk actually starts coming in when the delivery happens and the levels of progesterone and prolactin fluctuate greatly. That is when the milk actually starts coming in. And when you
Okay.
are trying to do that before delivery, when the hormones have not really reached and fluctuated the way they should, you're trying to forcefully remove it, which may or may not be of great use. So
Okay.
personally, I would just say that stop, wait, and after delivery, do everything that you can to remove the colostrum and give it to your child.
Okay, yeah, I think that's a good point. Because yeah, I mean there are a lot of information available, but just waiting and then doing it starting at the right time. I think that's being patient about it. I think that's good. So let's talk about maybe the storage, right? So talked about colostrum before delivery. I think, as you said, it's not very ideal. Let's wait and be patient and do it after delivery. So how about mothers who might end up being away from the babies for any reason, like maybe the baby is in an ICU, or the mother herself is probably physically recovering with due to some reasons. So how does that impact lactation? Because as you said, the initial hour is very important, but if that's not happening, so what can the mother do to ensure it's not hampered, as well as if that has already hampered, then what can she do, and if there is any storage that she can do, and how it should be done, what are the best practices?
All right. So, if a mother for some reason is not able to feed her child directly in the beginning or whenever,
Mm-hmm.
then it is best that she expresses milk. If if the frequency of feeding has been say every 1 hour or every 2 hours, then that is when, leaving that gap, she should make sure that she is trying to drain out the breast from both sides. Preferred tool is hand expression.
Mm-hmm.
So making sure that she's trying to remove everything that is there, and that can be taken to the NICU and fed to the child by a sister there. So if
Okay.
she continues to do that throughout the day, ideally a newborn feeds anytime between 8 to 12 times in a day. So she should try to make sure that she's expressing milk that many times in a day at least, so that she is able to give her own milk to the child, and that will help her in improving her supply. So few days from now, when the baby is with her and she wants to feed, she may not feel that okay, my baby is coming and sucking but I don't have milk.
Right.
That should not happen, because she knows that she's been working on her supply even when the baby was not with her. If
Right.
there is a mother who's going to be doing it midway, not for a newborn, but a little later, for some
Mm-hmm.
reason she's traveling, she's going away, or she's undergoing a surgery and she's not going to be able to feed her child, then she can start expressing her milk a little in advance. Based on that, can be told to her based on how much of milk she's making, so we can chart it out and we know how much of quantity is needed, so she can accordingly start expressing milk in advance, and she can store it. Usually milk storage is to be done in small quantities, say 30 ml quantity would be ideal. And you do have storage containers or storage bags available. You could look up online. So if you have those which are sterile and BPA free,
Mm-hmm.
so you can collect milk and store it in that.
Mm-hmm.
Usually, freshly expressed milk can be kept at room temperature for up to 4 hours. So she can use it anytime in the next 4 hours. If she's expressing now and she wants to use it later when she's not going out and somebody else can give it to the child. So that's okay. But if she wants to keep it for a longer time, then she needs to keep it in the refrigerator where she can keep it for a good 2 days,
Okay.
storing them and labeling them. She should mention the time and the date. Okay, and if she plans to keep it for longer, so when mothers go for work, they plan to resume work. So they are trying to just have a stash of milk which can be used later. So that can be kept in the deep fridge and it can be stored there for a good 3 months, making
Oh.
sure that the conditions are good, sterile. She's doing everything in a hygienic condition, taking all the necessary precautions. Again, labeling everything. So she can keep it there. How
Mm-hmm.
can you give cold milk to your child? We can't. So you will have to remove it from the refrigerator, allow it to thaw, become, liquidy or come to room temperature. And in whatever container it is stored in, you could dip that container in a vessel with warm water so that the milk is at room temperature. Take a drop, check the temperature, smell it. If all is good, it can be offered to the child. Once the milk is brought to room temperature, you should not be storing it back. So you have to make sure that you finish it in the
Mm.
next 1 hour. So that's what the protocol is. And this is what mothers are doing everywhere. They have been stacking up milk, going for work, pumping at work, and trying to feed in this manner.
Okay, okay. So you also mentioned about the hand expression, like, the best way to do it. So are there any guidelines like how, like what the container should be like, or, how the mother should make sure her hands are clean and all of those things? Because maybe
Yes.
she's in a hospital, so it's
Hmm.
not like at home we have access to everything that we want. Maybe in a hospital she might not. So, what are those basic two, three things that she should just, be ready with so that if she requires, she can do it?
So hand expression is a very nice hand expression, and you know what exactly are you supposed to do in hand expression. So that's one thing. Now coming to hand expression, you just need to have wash your hands thoroughly well, make sure that the breast is clean, and have a container. It could be a steel vati or silver container, sometimes silver bowl mothers take, but it has to be sterile. By boiling water can help her hold it under her breast with her hands. So that's all that she needs to carry. Maybe she need to carry a few if she's away and in the hospital where she can use one after the other for the next 2-3 feeds. Of course, in hospitals, everything is taken care of. They have bowls and containers which are sterile, so they don't need to worry about that in the hospital. And the sisters would help them in expressing milk. But once they are home, they need to take care of all this. I have seen mothers do all of this and then remove the vati with their hand and wipe it with a napkin. So
Mm.
when you do that, you are defeating the whole purpose of sterilizing the bowl. So once the bowl is sterilized, you should not be touching it with anything else, not even with your hands or fingers. Anything that is going to go in the baby's mouth, like the front part of the spoon, it should not be touched with our fingers. So these basic, hygiene and care that has to be looked into.
Okay. Yeah. I think we have a question. Maybe I'll read it out here. So
We'll keep the name anonymous.
I think
Or
it's displayed, so it should be okay.
yeah.
So I'm a mother of 3 months old baby. Wanted to know if there's any table which says what is minimum time we need to feed a baby per session, especially for 3 months old. Like, is it 15 minutes? And for 4 months old, is it 20 minutes? So, is there any time like duration which is the best suited for that age baby?
Okay. Yes, thank you for your question. There is no time that you're supposed to feed for any child actually. So, in fact, as the child becomes pro with breastfeeding and the older they get, their breastfeeding time starts reducing. So if the mother has been feeding, taking almost half an hour to feed initially, and as the baby gets used to breastfeeding, and both of them are, very well equipped with all of that, they know it very well. The feeding time usually starts reducing, and mothers wonder that he's hardly sucking for 5-7 minutes in and out. So is that going to be enough? But yes, that is how it works. So when you're taking too long to feed, you're taking hours to feed your child and still wondering that, my baby is still not getting full, make sure there is probably something wrong in the way you're doing it. Maybe the latch is not effective. Otherwise, breastfeeding doesn't take very long. So there is nothing like 15 minutes or 20 minutes for a 3-month old or a 4-month old. It should always be done on demand and for as long as the baby wants to. Breastfed babies rarely overfeed themselves, and they will leave the breast once they are full. And if they don't continue to leave the breast for hours together, that means they are not full. And then you need to look into different things that probably could be going wrong.
Okay, okay, yeah, that's
The time actually, as per the books, to empty one side of the breast is not more than 8 minutes.
okay. Okay. So if it's more, let's say it's probably taking half an hour in some cases. So does it mean that we are not producing enough, and in that case we just follow the same rules of expressing more often and then pumping maybe. So is that the solution to it? Like if the
No,
baby is
see,
taking more
this
time.
timeline is just for the books, that eight
Okay.
minutes it will take to empty and all of that. But if
Okay.
you feel that I'm feeding my child for a good half an hour, 40 minutes, feed for as long as you want to, unless it's getting exhausting. So when you feel that I'm just sitting the whole day feeding, or I'm feeding for a
Hmm.
good 1.5 hour and the baby is not getting full, that is when you need to look into things. But if
Okay.
I'm feeding for a good 40-45 minutes, after which my baby is fine, seems satisfied, sleeps off, or is playful for a good 1.5 hour, then there is nothing to worry in that. And you could feed on demand whenever he wants to.
Okay.
Also, there will be phases called as cluster feeding, where the baby would want to feed more frequently. And you would have
Hmm.
just said, and maybe in another 20 minutes, the baby may want to feed again. And that's the time when mothers wonder that, am I making less? Why is he just going on feeding like that? It's a phase because the body is going through growth spurt and he is going to be a little cranky that time. So don't worry about it. It's also your body's way to prepare you for the increased demand that's going to happen in future by frequent feeding and
So is there like a okay, I think we Dr. Anuja, I think there's some your screen froze for us. Just can
Just
we
check the internet connectivity, doctor.
oh,
is going on, or if your latch is fake.
Doctor, your volume has dropped. So can you just
Yes, I will just. Is it
uh
okay now?
actually we cannot hear you like we were earlier.
Are you able to hear me now?
it is low, doctor. I mean, the volume, your voice is sounding.
Okay. It's full here. There is,
I
I
think
mean, on the system,
It's
there is
okay. Yeah, you
yeah,
can
I think
continue, doctor.
now it's better a little bit.
all
Maybe
right.
yeah,
Okay.
you might have to speak a little bit higher in case
Yes,
it's
I'll
some
do that.
technical thing. Yeah.
Yeah,
Yes.
doctor. Now it's clear. You can continue. Yeah.
Yeah. So don't go with
Doctor,
the
the
time.
just the person who asked the question has told thank you.
Okay. Thank you so
Yeah,
much. Thank you for asking your query.
yeah. So
Welcome.
we'll keep the names anonymous. If they explicitly mention that, mention their name, then we will do that. Yeah.
Sure.
Okay.
Yes.
Yeah, I think you were talking about, okay, maybe we'll move to the next question
Yeah.
because I also wanted to ask about, since we were talking about babies not being able to be with the mother soon after birth. So, does that have an effect on the mother's supply? Like, not just that, I think we have painful breastfeeding probably because of tongue tie. That is a technical term I got to know only when I had a baby, and I heard about all those things. So are there any such different factors that influence a mother's breastfeeding experience, and so that just they are mentally prepared to be aware of it and get it diagnosed also at the right time?
Yes. Now, like you asked, if the baby is away from you and you are only expressing and giving milk to your child, is that going to really hamper the supply? Not significantly, but it still may, because the way the baby sucks onto the breast and stimulates the hormones is different from how we do it, and we are trying to forcefully remove the milk from the breast using hands or pump. So the stimulation is very different. It's a lot more natural, organic when the baby is sucking, and that's why the breast releases everything that it has. But when we are doing it through pumping or hand expression, we don't really see the actual volume that we have the capacity to store. So they are a little different in that way. But removing milk and trying to drain your breast is a way of maintaining your supply when you are away from your child. So it will still help you in having a good supply instead of not doing it or not feeding the child at all. Talking about the next query, that's tongue tie. So yes, tongue tie has it's quite a thing these days now. It was there earlier also, but just that now mothers are more aware about it. Now, what is a tongue tie? If you lift your tongue and you see there's a small band of tissue that's attaching your tongue and the floor of the mouth. Now, because our tongue is free, although it is attached, the movement is still free. And I can easily remove my tongue out and cross it beyond my lower lip. When that band of tissue is a little thick and tight, the fibers are short and thick, the child is not able to extend the tongue freely, even in lateral or side to side movements and even outside, tossing the lower teeth or the lower lip. And that's when his tongue movement is restricted. Now, in correct breastfeeding, if this is the breast, the baby's tongue is somewhere here. It pushes onto the breast and milk is expressed or removed out from the breast. But when the tongue is not able to extend properly, the tongue just keeps flapping here and irritating the nipple here, causing soreness of nipple and pain and ineffective breastfeeding. So generally, all babies have a tongue tie. Everyone's tongues are tied, and that's why every tongue tie need not require a release. So if you feel that there is a tongue tie, you should get it checked from somebody who has enough knowledge about it, ideally a dentist or pediatric dentist or a
Okay.
lactation consultant. Having said that, the treatment to that would be releasing the tie and allowing the tongue to move freely, which is a procedure done either surgically or through lasers. But should we be immediately jumping onto that? No. Even in a patient or a baby who has a significant tongue tie, and if the breastfeeding is going fine, mother has no issue with an improved latch, there is effective breastfeeding and pain-free breastfeeding, then it may not require a surgical intervention at that stage. If there are any issues with speech, it may still require some intervention.
Doctor, your feed has again frozen.
Yeah,
Yeah,
so
doctor.
Yeah, I think now it's better. So your screen was frozen for us for a second.
okay, and it was the same for me. I Your screen was frozen, so I was
Yeah,
not
maybe
sure
it's
if
just YouTube
some
stuff. Like
technical problem. Yes.
it's pretty technical stuff. Okay, so and there's also like inverted nipple, flat nipple. So we hear that it's not ideal for breastfeeding. So can you tell us about that?
Okay, so see, the nipple is usually it is a little long and well-rounded and projected, which is more like a normal nipple. When the nipple is slightly flat and in level with the areola, you can say that it's a short nipple or a flat nipple. And a nipple which is inverted is actually inside. And even after stimulating it and pulling it outside, it still goes inside. So inverted nipple is a challenge sometimes in breastfeeding, and it does need some amount of guidance and practice. It takes time. But with regards to a short nipple, sometimes it may not be as difficult as it's made to be. So also I would suggest that when you all are going for your gynecological visits during your 9 months of pregnancy, you should ideally be asking and talking to your gynecologist and asking them to examine the breast whether you have any flat nipples or inverted nipples. Because it should not come as a shock to you after delivery when you are told that no, you have flat nipples, so you can't feed your baby. So, that really stresses the mother a lot, and she has no idea of what a flat nipple is. So keep in mind that nipple does not really play, it does have a role in breastfeeding, but it plays a little less or a secondary role in breastfeeding compared to the breast. So it's not the primary thing for you to have effective breastfeeding. Even with a flat nipple, if you are taught how to hold the nipple, how to position the nipple and breast, you will still be able to breastfeed well with correct guidance.
Okay. And if, let's say, an expecting mother discovers it during her visits, so is there anything she can do about it, or just be mentally prepared and learn the right techniques? Like, what can she do at that stage?
Yeah, so while she's expecting and not delivered, it's not ideal to try to stimulate the nipple or pull it out like an exercise. Like I told you, we don't want premature labor. So that has to be delayed, and she could do it only maybe a day or two before her delivery, which is not going to help in a big way. But later on, after delivery, as the baby breastfeeds more often, the nipple length sometimes starts improving. Pumping, breast pumps do help in improving the length of the nipple over time. There is something called as a nipple puller, which the mothers usually creates a vacuum and pulls out the nipple. But in my personal experience, it's very momentary, and within a few seconds, the nipple goes inside again. So it doesn't help too much. But what has made a difference over time is probably pumping. That has improved the length of the nipple.
Okay, okay, that's good to know. So maybe I have some more questions which I have noted down. So
Before
Sujay, you
before
want to?
Aditi takes the second or third question, Doctor, what is in for the male fraternity, the fathers or any guardian who is a male who is trying to support the mother here, or the female or the lady here who is expecting a child or who has delivered a child? What is there for the fathers out there, how they can support and how they can approach this particular thing? Because uh, s- before the delivery, as in the pregnancy time and after the delivery, uh, there yeah, I mean, the society basically tells the male fraternity to just take a back
Go
seat,
away.
just to take one step behind and then just watch it from there. So how, in this modern society, how, what is the role of the father when it comes to these situations, these departments? Because even with the hospital, again, they are asked to stay one step behind and then watch from there. So what is your perspective on this?
Yes. Now, see, there's a new thing that even when you're expecting a child nowadays, you don't say I'm pregnant, but you say we are pregnant. So,
Right.
the role starts from there. And it's equally important, according to me, for the father to participate in every phase of breastfeeding, beginning from labor. So, if there
Right.
is one person who is permitted inside the operatory, it could be the father, unless the mother wishes to have somebody else.
Mm-hmm.
Along with that, breastfeeding should not be something that he should be going out of the room and then the mother can feed. So that should not be happening. He should in
Right.
fact help the mother hold the child, get her closer and latch the baby in a much better way, because there will be nobody else that the mother will be comfortable with than him. So also the fathers play a very important link between the mother and the other members of the family. It could be the
Right.
elders and the extended family. So he's a very important link because she will share a lot of her stress, anxiety, and other concerns with her husband or her spouse. And it's pretty much in his hands how he could navigate the situation at home to try and get a little more support for her from the other members of the family by bringing in some more awareness and education. So I feel it's very important for fathers to be a big part in breastfeeding. It takes away the stress from the mother in a big way, especially night feeds. It should not so happen that the father is sleeping peacefully and the mother is waking up feeding the child every 2 hours. No, he can help her with changing the diapers, nappies, burping the child, putting the baby to sleep while the mother is resting. If there are feeds given in some other way through spoon or palate, then why should the mother be doing it all the time? Baby can be with the fathers, and fathers can learn how to do that because mothers are learning so much. So why not the fathers? So there are many ways in which the fathers can chip in, even running random errands at home, getting stuff, whatever she needs, buying things, keeping some things for ready for the kitchen, all of that. So there are multiple ways in which a father can show that I'm wanting to help and he's ready to help, and that really makes a big difference to the mother.
I think that is the real way of, I mean, as the tagline says, closing the gap. So I think
Yes.
all the fathers out there, the male fraternity, I think we should all be supportive in whatever capacity that we can. I think we should go full throttle and say we are pregnant and be with the wife, be with the mother of their child. I think the entire situation in the family, in the I mean, the husband and wife will improve, and more happiness will be coming our way.
Yes,
Yes,
that's
it's
right.
very nice when both the parents, mother and father, come to me with queries and how they tell each other, no, this was left to be asked, and no, you haven't asked this, or they have their own set of questions like you both had come. So it's nice to see that instead of the mother coming with her, elders in the family where they have another thought process and her thought process is different. So I think yeah, things are changing. It's good. I am seeing more of parents coming, and that's a good thing. So it should
Right,
go ahead like
right.
that.
And we will be on the same page
Yes,
when it comes to these matters, sensitive matters. Yeah.
absolutely.
Yes. So, I think I have more now onto the working mothers. So usually, like in India, especially, we have 6 months of approved, like paid leave. Maternity leave is usually for 6 months, unless it varies in exceptional cases. So usually after these 6 months, the mother is expected to visit office, go to office, even though with flexibility they have to go. So in that case, surely expressing and storing is an option. Oh, me again. Okay, sorry, again something with YouTube. Yeah. So in that case, it's an option. But how to manage the whole mental stress around it, because now that she is working, she also has the pressure of proving at work, because she was lagging behind in certain terms for those 6 months. So what can she do to ease her mental health, be easy on herself, and not be worried about the quantity and stuff like that? So what can she do best from her side?
Yes. So when she's looking at resuming work, she should be very clear in her mind at for how long is she planning to or looking at breastfeeding, because that will take demand the steps that need to be taken now at this stage. If she's wanting to breastfeed exclusively, even beyond that, whatever feeds along with starting solids are given have to be entirely her milk, then she has to start expressing and having the stock of her milk much earlier, which will be planned, and accordingly she can start doing it. If there are mothers who are okay with when they are away, I don't mind if any other milk or formula is fed to my child, and when I am at home I will breastfeed my child. So
Hmm.
she has to first be clear of what she is planning to do and what is she wanting. Accordingly the plans will start falling in place, and this plan of hers, or this whatever her idea is of how long to breastfeed, has to be conveyed to her spouse and also to the other family members. So if she's okay with giving a formula to her child, then that has to be told to the other members of the family so that they don't make a fuss over it. because ultimately it's the mother's decision. She's making her own choices, keeping everyone's health and needs in mind, her own and her child. If she's wanting to go out and express and feel, that also should not be made into a huge thing. And the necessary kind of support, even at workplaces, should be offered to her. So half an hour of gap, she may need twice, while she's at work to at least pump some milk. So that much of space and provision has to be given even at workplaces. So if she knows
Right.
what her plan is, then accordingly she has to start talking about it and conveying it to everyone in the family, to her friends, while they are talking about work and resuming work, so that it also spreads at her workplace. And when she goes and suddenly one fine day she goes and gets a pump and goes inside to pump, there are not many people. You don't want too many people staring at you. What's wrong with you? Come on, your child is now 6 months. You don't want those reactions because you know what you're doing and you're okay with what you're doing. So try conveying that to people. If they understand, it's well and good. If they don't, even then you will still stick to your plans, but you will be mentally prepared about it.
Right. I think for the mother, that phase is very challenging because she's already guilty herself for, having to leave her baby at home and, concentrate on her career and her work. And having clarity herself and being confident about her decision on how she wants to continue, like, with mixed feeding or, exclusive or whatever it is. I think that clarity is going to, help her a lot. And I think, yeah, talking more about it might also help, because I've seen firsthand that, mothers are guilt tripped. Like,
Yeah.
oh, you're not breastfeeding. Oh, like, including some, pediatric, visits. Like, there's a lot of guilt tripping going on. Like, 2 years you were supposed to do it and things like that.
Yeah.
So, yeah, I mean, I feel that gap should be closed, and one should also
Absolutely.
start thinking in a more practical sense of what is practical for the mother at that stage. So
Right.
coming to that, like the 2 years, right? 2 years you should breastfeed, that's the standard. I think it's mentioned everywhere. But what is the next best realistic timeline for a mother to aim at, considering work, or even if she is not working? What is the next best timeline that she can at least, thinking, okay, this is probably possible. If not 2 years, then maybe this I'll try to do.
Yeah, so see, even after we resume, the mother resumes work and then continuing to express milk or pump, it's not very easy. It's quite stressful. It adds a lot of work in her already busy schedule. So she has to manage that well, and it can get exhausting. So it's not very easy for her to do all of that, and she has to plan her journey accordingly, and that's where she also needs support. There are mothers who sometimes do it, and there are also mothers who feel that I have tried to feed my child for a good 6 months, and now I will go a little easy. So when I'm away, I'm okay with something else being given. When I'm back at home, I will feed my child, demand feed
Mm.
whenever during the night and until the time I'm at home, which is the next best and the next practical option for many mothers.
Right.
Mm.
Although I have seen a lot of mothers, even in the guidelines, if you see, 2 months of continued breastfeeding. By what? By 2 years, sorry. By that they mean that even after 6 months and even after your baby is consuming 3 or 4 solid meals a day, at least try to give your own milk once or twice in a day. Could be before nap times, could be before the night sleep, but make sure that some milk is continued to be being fed to your child at least in 2 years. It's mainly for the immunity also. If that 2 year mark seems a little tough to reach, the next best option that IAP suggests is at least in 1 year. So make sure that you are trying to give your child your own milk until 1 year and then gradually start off with the entirely weaning process, which
Mhm.
will take a couple of months. It doesn't happen overnight. So in the long run, you end up feeding a good over a year. So these would be the next best options for the mother to go ahead with if she feels that pumping at work is difficult or having the 2 year mark is difficult reaching that.
Okay. And how can workplaces support a mother? So I believe just having a space for mother is not enough. Like there should be something additional done by probably the human resource department, HRs, or maybe the immediate managers or leads that the mother reports to, or she herself is one and reporting to someone. So what can they, like what should their
Mindset.
what should they know, like what should they be aware of, so that they are giving her flexibility without feeling the pressure of bias, like
Right.
she's a woman, so he's giving or she's giving her a lot of bias because she came from maternity. So without worrying about all of that, what can a company or an HR or a manager do to enable such a flexible environment for a mother?
Yes. So even at workplaces, you are ideally, there is probably a criteria that if you have more than so many number of people employed in your company, it is you are supposed to have a nursing room or a room where the mother is allowed to go and rest, take her break, even if she doesn't want to express her milk. So this thing should ideally be put into practice even in bigger companies and corporate workplaces, because that encourages the mother. It's one mother who will start using it and then won't follow, and then ultimately people get used to it. That okay, this is a room, acha, why don't you go there? We have this. So it takes time to catch up, and there has to be somebody who does it. But for that, the chief or the director who is heading all of this also needs to have some sort of information awareness, and he also needs to feel for it. It should come from within, that yes, it's not so easy to leave a 6-month-old child and come. Your job of giving a 6-month leave and done, the maternity thing is over. It doesn't really end there, and there are too many other things that as an outsider I may not know, and those concessions don't come in the category of bias, but they need to be offered, and that will probably they will understand that when maybe the first few mothers may have a tough time, and eventually they start understanding it when they see mothers are actually struggling to keep the two things, keep the ends together. So it does need some effort from the employees and also the one from the administration, both ways. If there are rules put into place, which are, but whether they are being followed or no, that has to be done on an individual basis. Or if there are too many women in the company or fathers in the company, why don't they come together and contribute? And instead of having baby showers and bringing gifts for your friends at offices, instead of that, come up with a place and encourage them to just resume work and make sure that they get their rest and time to comfort whatever is necessary.
Right.
Yeah, yeah, very, very important. So I'll just check. I think we have covered a good number of points. Um, so one question is like, is there a, time period during the especially the first few let's say take 9 months? Is there a phase when the supply breast milk supply automatically starts reducing due to certain physical bodily factors of the mother? Like, is there like a time duration when this happens? Which month and all of that?
No, not really. A mother is the mother. I mean, if you are continuously breastfeeding from the beginning, the body continues to make milk. In fact, milk supply improves with the next pregnancy. So there is no time frame where in this month you can see a drop. However, when the mother resumes her monthly periods, she does sense a little bit of a drop in her. She could sense a little bit of a drop in her milk supply, but all that she needs to do is continue with her schedule of pumping, expressing, feeding, whatever it is. And over a few days, she will see that the fluctuation has just gone off and she's back at her supply. So she needs to take care of that. The longer you feed, the more you delay your periods from resuming. The mother who has not breastfed, or who's breastfed for a very short time, she may have her periods coming in very soon. So that's the only thing where you have a little bit of fluctuation. But apart from that, there are mothers who have fed their children for a good 4 years also. And that's enough, because as the child grows, his capacity to drink milk is reduced. He's drinking it not really for nutrition, but he's drinking it as an emotional bond and for comfort. So volume is not really needed. That much of volume, the kind of volume that would you would need for the first 6, 8 much of volume is not needed, and your body is able to produce that later if you are regularly breastfeeding.
Okay. So how can a family support a mother? Like family as in, I think we covered the partner part, but how about the maternal side or the paternal side of that baby? So how can they maybe be easy and supportive in the right way for the mother?
Yes, I think firstly by not stopping the mother from doing things the way she wants to do, not telling her that no, it's not done this way, and our time we never did all this. It starts right
Hmm.
from taking prenatal consults also. Why do you need to learn how to breastfeed? I mean, we have been doing that all our lives. Families and generations have been doing it. It's not that. So she may want to have her own set of knowledge which she feels is now in par and it is correct as per the current standards, which probably nobody in her family will be able to tell. Also, what our elders tell us in the family is out of their own experience growing up two or three children. It's all in goodwill, but their experience then is limited compared to the experience of an expert who has seen over 100 children in different situations. So that's when these expert opinions matter. So they should not stop her from doing certain things because somebody has asked her to do. My doctor says so. Okay, then I probably feel there must be sense to it, and they should in fact support her in her decisions. Even when the mother chooses to introduce a bottle to the child, or she chooses to introduce a formula to the child, or for some reason she's not able to adequately feed her child, and when you have relatives coming in, and if there is anybody saying anything to her, it is the family who must step in. So, these are little things that do take a toll on her mental health, and that's in a big way where your family can actually chip in and support you and be together with you in whatever decisions you make because they know that it's always going to be in the interest of the child. Of course, there will be many things out of experience that they know, and they may tell you that no, don't do it this way, and they should have that freedom to give their opinions. But whether it is followed or no, whether it's exercised or no, should be the parents who decide, and the elders in the family should be happy with all of it. If they
Right.
are able to do this much, they will support the mother in a big way. Apart
Right.
from that, taking care of the child when the mother is sick or sleepy or tired, making some nice thing for her, something that she likes to eat. These are just secondary things, but that will make her happy. So these are
Right.
little things that they can take care of, because nobody expects them to stay awake day and night with the newborn. The parents will be looking into that, but smaller things can be looked into this way.
Right. Yeah. Very
Yeah.
true. Yeah. You have
Yeah.
anything?
No, doctor. I mean, are there any things that may have not been covered that you want to highlight on?
Yeah, I would want to say that keep in mind that while you're feeding your child, if you have pain while feeding, and so many times we are told that it's okay, you're doing something new in the beginning, you will have pain while feeding, then no, it is not right. If you're doing breastfeeding correctly, you should not be having pain. So if you are in pain, because when the mother is in pain, she's not going to be able to do it for very long. And as a human being, I can't expect somebody to go on doing something when she's telling you that she's in pain. It's wrong on our part. So, breastfeeding done correctly does not pain. And if you have pain while breastfeeding, there has to be something wrong in the way you're doing it. And do seek help in such a case. Secondly, we don't nipple feed, but we breastfeed. So most of the mothers, they try to pinch the nipple and try to put it inside the baby's mouth, which is wrong. And then they wonder why is the baby not getting full, or why am I feeding day and night. That's not the thing. That is because we breastfeed and make sure it's not just the nipple, but a good breastfeeding mothers come with long hours of feeding and painful nursing. So look into these aspects.
Right. Right.
Okay. So is there any right way of feeding, like position or, something that the mother should follow for her comfort as well as the baby's?
Yes, I could just show you the most common position that I have seen mothers do. So if this is the baby, usually the baby is here and they are feeding the child like this. Now keep in mind that the baby, even when we eat or drink, we don't eat or drink like this, we face our food. So while you're nursing your child or breastfeeding, the baby must always be turned towards you. There has to be a good tummy to tummy contact and don't uh, hold your child like this. Second most common thing that I see here is the baby is always wrapped while feeding. We call it swaddling. So open up that dupti or wrap, whatever it is. While feeding, don't restrict the child, because when I'm positioning my child in a certain way, my baby may want to bring his hands closer on the breast. They will bend their legs. They will push out their bum, jut it out. So they are trying to make themselves comfortable. We can't be tied stiff like this and expect to drink comfortably. So, don't do these things. Thirdly, don't try to pinch the breast or the nipple and try to put it in the baby's mouth, bending down and sitting like this. Sit comfortably and never feed without a pillow. So make sure that you have a good cushion or a pillow support on your lap. Now, most of the times the pillows are like this. That
Hmm.
doesn't really help. So the pillow should be such that when I keep the baby on the pillow, my baby is at the length of my breast and I don't bend down in any way to reach my child, so that I don't land up in backache a month from now. So keep
Hmm.
these things in mind and make sure that it's not just the nipple but a good part of the breast that is going into the baby's mouth, for which you need to face the baby towards you and try to get the nipple on the upper lip and lift the baby slightly to get the baby on the breast. Don't push the breast inside the baby's mouth. Also know that it does need some amount of practice. It's not that we teach or you saw some video and will get it overnight. It doesn't happen like that. Mothers need a good 3 to 4 weeks to actually learn the latch right. So it needs practice. It's a learned skill. Take your time, but learn it right so that you will be able to do it for a longer. Even if it is a mixed feed, you will still be able to continue at least with 1 to 2 feeds for as long as you wish to.
Right. Yeah. Thanks, doctor, for that. So, can you check if we have anything? I'll check my Instagram also. Uh, hmm,
Yeah, doctor. I mean, what is the right time to approach Anandi Lactation Support Group?
So
As in, doctor,
ideally,
is it in the
yeah.
last trimester that they start this particular conversation with you and the group, or post pregnancy when they can approach you?
and what are the ways, like,
They,
how to come to
yeah.
you?
All right. So mothers usually come to me with problems. So they are well into 2 weeks or 3 weeks postpartum, and that's when they approach because they are facing difficulties. I would say 8th month or 7.5, 8th month ideally would be a better time, and
Okay.
because we do offer follow-up support after the baby's birth, so that
Right.
would be a better time to get your knowledge and then take guidance once the baby is in your hand. Also, if you're struggling with breastfeeding and not sure of whether baby is getting milk, is it enough or no, don't wait for too long. Don't wait for a month and then come, because we have lost out on an important month then. So in that case, reach out within a week's time or 8-10 days so that things can be sorted faster. The smaller the baby, it's easier for the baby, to make him used to certain things.
Right.
When the mother comes to me when her child is 3 months old and she has not been able to feed the child for 3 months, direct breastfeeding, and now she wants to get the baby on the breast, it becomes quite difficult. Not little, but quite difficult because it's a big baby and they are used to a certain way of feeding for 3 months. So you have to start from the beginning, right from building a rapport and making the baby familiar to the breast, knowing that okay, this is also a place from where I get milk. So the challenge seems a lot bigger in that case. That's why start off early. Having said that, I would also like to tell you the importance of breast milk and why is there so much of stress over it. Apart from you knowing that there is nothing better nutrition wise for your child at that particular age, also the
Doctor, just hold your thought. Uh, I think there is some network problem. Yeah.
The baby's requirement. So
Doctor, can
when
you maybe repeat that because it was very important,
Yeah.
but I think there was a technical problem.
So, nutrition wise, there is nothing better than mother's milk for the child, and that is why, if you have a look at the formulas, they have groups of 3 months, 3 to 6 months, because they keep changing their nutritional value accordingly. With mother's milk constantly changes. It's not the same what it was on day one and what it's going to be at month two or month four. When I latch my baby and breastfeed my child, my baby's saliva enters my body, and that is what the body senses and adjusts the nutritional component of the milk accordingly. So there is nothing more beneficial for the child, of course. Apart from that, immunity is one thing that the child heavily relies on from this milk, which is lacking. We have not been able to create that artificial formulas. So mother's milk definitely has immunity, which nothing else can give the baby. Immunity to fight little infections, especially the upper respiratory tract and digestive infections, which the baby frequently falls sick with, and that immunity he gets from the mother's milk. Apart from that, of course, it's a very natural way of contraception. In the time you're breastfeeding, you're unlikely to, conceive and get pregnant again. Also, for the mother, it's definite risk reduction for breast cancer, ovarian cancer, cervical cancer, and
Right.
that depends on how long you breastfeed. So, because I have exclusively breastfed my child for 6 months, or I have breastfed my child for 6 months, yes, my risk is reduced. But the longer I feed, that will actually bring down the risk. So that's important. Mother's milk has a hormone of a satiety, leptin. That's why if you see a breastfed baby is not obese or extremely fat, they don't look very chubby. They are on the leaner side. Although nutritionally they are optimum because they don't overfeed themselves. They know when to stop, which is usually doesn't happen in bottle fed babies. Okay, because they end up consuming a lot more and a lot faster than what they get from the breast. Every time the mother breastfeeds, she releases a hormone called oxytocin, which helps in the natural contraction of uterus, bringing back her expanded uterus because she's not going to be getting into extreme physical activity in the beginning, and that is what will help her actually to get back into her shape while she's still breastfeeding her child without having to do any great diet restrictions and all of that. So breastfeeding has immense benefits. There is no doubt about it. So our job is to educate the mother about it. She should know the pros and cons of everything. And then after that, whatever the situation is and whatever decisions she makes based on the situation, to support her in all of that is the next big role. As a society and as a lactation professional, and I would say also as a doctor, I can't blame a mother because she's giving her formula. She has her own reasons to do it, and that is where actually I can be more compassionate, and this is what ideally needs to change through all of this, which hopefully it will over time. But I wanted to tell you the benefits of breast milk and breastfeeding. Yeah, so here you go.
Yeah, I think that's good because making an informed decision, then you're not prone to, being vulnerable about, your others
Correct.
commenting about anything or anything for that matter. So you'll not be blaming yourself too much if we know and then took a decision about something.
Right.
So,
And then
Yes.
mother first and father are in the driver's seat when it comes to taking care of the child, right, doctor?
Absolutely. Taking care and also decision.
Also decisions.
decisions,
Yeah.
yes, very
Yeah.
important. So, yeah, I think, is there anything? So, one more thing, Doctor, I wanted to check with you in case any of our viewers want to know. Is it that, they have to visit you at the, center in Hubli, or are there different ways to approach you?
Yeah.
So usually I am here at the Hubli Center, but I do take consults and prenatal and also during the post-pregnancy, whatever challenges are there. These are also done online through video consult. So there have been many mothers. We have improved and got the mothers to feed only through video consults who are nowhere here, nowhere close to Hubli Dharwad. Of course, those need a little bit of patience and they are more time consuming. But I have seen over time, whether it's an online consult or offline consult, what really makes the difference is the mother and her attitude towards things, and how calm she is, how realistic she is in her approach. Then, with that, whatever decision she makes, she still is a winner. So that really is what makes the difference. But I am available for online and offline consults at Anandi. Our numbers are there on our Instagram page. Or if they drop us a message on Instagram, we always get back. And that's their way to connect with us. I also do home consultations and home visits. So the choice is there is whether they want a home visit or they want to visit us or opt for a video consult, online consult.
Okay.
Okay. In case a mother requests, like home consultation is one thing, but hospital consultation, do you also take up that during
Yes,
those
I
first few
also
days?
take that up. I do go to hospitals for hospital consultation, but my the criteria is that the hospital administration should be aware that I am visiting. I
Okay.
cannot go only based on the parents' call because
Mm-hmm.
I'm entering a facility which does not belong to me, and the hospital must have an idea about it. So if they are okay with it, then I am okay with it.
So it
Otherwise, I
should be
don't.
an official visit and not like a personal visit. Okay.
Yes, yes.
Okay. Yeah, I think we
Yeah.
have covered good enough points. So maybe before we say anything, Doctor, do you have any closing notes for this podcast?
Yes, firstly, it was a very nice concept that both of you came up with, and you all have almost covered everything that is important, even not for parents. Even if there's somebody else who's listening to it, this knowledge is not going to be a waste. So that's the best part of it, and thank you so much for it. And yeah, so I'm very happy that I'm able to do this with you, and I do see both of you spreading more of this, correct knowledge and guidance even among your friends. And I hope this continues.
Yes.
Absolutely, doctor.
Yes.
Absolutely.
So I think we had to mute because our dog had something to say in the background. Yes. So actually, I started with a thank you, and again, ending with one, because the points that we have covered in this last 1 hour is something which I would have been very grateful to be aware of if I was expecting a child last year. So I think this is very very good information to get within just this duration. And yeah, thank you for making time for us. And I think we are lucky being in Hubli Dharwad and having such a supportive and approachable lactation consultant. So thank you so much, Dr. Anuja, and hopefully we'll continue our collaboration in one way or the other in the future. Our viewers would be very 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 much benefited from this. I'm very sure of that.
Thank you. Yes,
So,
we'll
and
see
we
we
will
please
link your.
share this possibility.
Yes.
Yes, doctor. From both Sujay and Aditi, a big thank you to you
Thank you so much.
for
Thank you so much.
sharing. I mean, something which uh, we are not aware of in the beginning. So, this, as Aditi said, this 1 hour very productive, very educational, and it will help a lot of mothers and fathers to take decisions, to take care of their children, come whatever situation, and they can easily approach you via call or whatever it may be. If they are in North Karnataka, they can definitely come down to Hubli and maybe get a consultation from you. So, to all the subscribers and viewers, Dr. Anuja, uh, what we can do is you can give a big shout out, say like, share, and subscribe to Sujay Jalwadi channel.
Yes, I will do that. Yeah, so
Yes,
yes,
you
yours,
can
Dr.
start,
Anuja
doctor. Yeah.
Joshi from Anandi Lactation Support. This is Anuja, and I'm very thankful to Miss Aditi and Mr. Sujay for this extremely different opportunity to actually talk about not per se breastfeeding, but many other aspects with regards to lactation and breastfeeding. And they are both very good, very balanced, and very realistic in their approach to things. And do subscribe to their channel, Sujay Jalwadi channel. I have, and so you must. And they also have a very nice brand called Fathers, if I'm not wrong. They make it's a bag which it's a brand which makes the bags are manufactured locally in Hubli, and I'm very soon going to be buying one. So you must go have a look at their website, check out their pages on Instagram, follow them, and support everything that is local. Especially people like the two of them who are very encouraging, supportive, and very realistic and reasonable to accept everything.
Thank you so
Thank
much, Doctor.
you.
Thank you.
And to
Thank you
all the
very much.
viewers and subscribers, do check out Dr. Anuja Joshi's Instagram page, and then we will put up links how you can approach her, how you can contact her. This particular podcast, which was live on YouTube on 3rd August, I will again reiterate, August 1st to August 7th is World Breastfeeding Week. So, all three of us will do a big thumbs up, Doctor, to World Breastfeeding Week, and we will be signing off.
Signing off, and this is a live, but this exact same whatever we
Uncut,
talked, uncut version of it will be
uploaded.
available. I think just after saving for some
Yes.
time, it will take some time to save, and it will be available for you. So watch it and share it with your friends, family, colleagues, whoever you think should be aware of this information. And we will probably also upload shorter versions of the same video.
Yes.
So yeah, thanks for joining, for all the subscribers, and we sign off.
We'll sign off. And once again, Dr. Anuja Joshi, thank you so much.
Thank you.
Thank you.
Thank you so much, both of you. Thank
Thank
you.
you.
Bye.
Bye bye.
Bye.